Herpes viruses part 2. Varicella zoster virus. The virus causes following two diseases: varicella, that is chickenpox, and herpes zoster, that is shingles. Hence the virus is also called varicella zoster virus. It has the smallest genome among the human herpes viruses. It causes latent infection of neurons. The primary contact will cause chickenpox or varicella, and reactivation of the latent infection causes zoster. Varicella route of transmission, respiratory route. The pathway: varicella zoster virus enters through the respiratory route, multiplies locally, circulates in the blood, localizes in the skin and mucous membrane and internal organs. The incubation period is about 10 to 20 days. In clinical features, it is generally mild. Varicella is a mild infection, highly infectious childhood viral disease. There are vesicular lesions, vesicular rashes, mostly on the trunk. The rash progresses through the macule, papule, vesicle, pustule, and scab stages. Complications include pneumonia, post-viral encephalitis, and hemorrhagic varicella. Then herpes zoster, that is shingles. It is a disease of the old age. Virus remains latent in the dorsal root or cranial nerve ganglia of patients who had chickenpox. The reactivation will lead to lesion of herpes zoster, that is shingles. It occurs in patients of cancer, immunosuppressive therapy, and trauma. Clinical features of herpes zoster: inflammatory reaction in these nerve roots and ganglia accompanied by eruption of crops of painful vesicles in areas of skin supplied by the nerve. Thoracic neurons are more commonly involved, and generally it is unilateral in distribution. In immunity, one attack confers lifelong immunity. Complications of herpes zoster include ophthalmic zoster and keratoconjunctivitis. Transmission: respiratory route, vesicular fluid. The lab diagnosis: in microscopy, Zhang cells can be demonstrated in the scrapings from the vesicles. Culture and isolation: human fibroblast cells can be used. In serology, complement fixation test, neutralization test, and immunofluorescence test can be performed. In prophylaxis, varicella zoster immunoglobulin is given. These are the lesions of chickenpox. Disseminated chickenpox lesions on the back. Note the fluid-filled appearance of the lesions. Then cytomegalovirus or human herpes virus type 5. It is a common human infection which is mostly inapparent and the most common cause of congenital defects. It causes severe infection in the immunocompromised. Cytomegalovirus has the largest genome among the human herpes viruses. It is shed in all body secretions: urine, saliva, tears, semen, cervical secretions, and breast milk. Pathogenesis of cytomegalovirus. Cytomegalovirus infection mostly occurs as a latent infection, and the target sites are mononuclear leukocytes and epithelial cells and stromal cells of bone marrow. It replicates in the ductal epithelial cells, which promotes excretion in most body fluids. The clinical features of cytomegalovirus infection include hepatosplenomegaly, jaundice, thrombocytopenic purpura, pneumonia, and CNS damage. It occurs mostly in the immunocompromised patients. The CMV infection can occur following transplantation and transfusion. Congenital cytomegalovirus infection. In the first trimester, it may lead to death of the fetus. CMV causes microcephaly, hepatosplenomegaly, intracerebral calcification, rash, mental retardation, and hearing loss in the child. Perinatal transmission is also possible. Perinatal transmission can occur through the infected birth canal, colostrum, breast milk, and perinatal blood transfusion. So there are several routes of transmission of cytomegalovirus infection: respiratory route, blood transfusion, organ transplantation, secretions including urine, saliva, cervical secretions, semen, breast milk, and tears, venereal transmission, congenital transmission, and perinatal transmission. So there are various routes of transmission of cytomegalovirus infection. In lab diagnosis, in microscopy, Giemsa stain of the urinary deposit, stained biopsy tissue of the kidney and salivary glands show characteristic enlarged cells with large internuclear owl's eye appearance inclusions. In culture, diploid fibroblast cells can be used. In serology, torch test is performed. Blueberry muffin lesion in the cytomegalovirus infection. CMV lesion. With this, we finish part 2 of herpes viruses. Thank you.